So it is chapter 2, body structure, right? So according to this book and chapter 2, the objectives say, upon the complete of this chapter, you will be able to list the level of organizations of human body, understand the meaning and uses of term related to direction, plan, and quadrants, and also region of the body. Describe the standard positions of the body placement that are used to perform the patient examination, X-ray, and medical and surgical procedure. Identify combining forms, also suffix and prefix according with the body structure. Recognize pronouns, build, and also spell the medical term and abbreviations associated with the body structure. Demonstrate your knowledge of this chapter by successful completing the activities in this chapter. So this is our objectives from this chapter. Next, go some vocabulary review. The term anterior. So this say anterior, right? Anterior means the front or pertaining to, meaning towards the front of the body, organ, and structure. So anterior means the front side of the body. Okay. Anterior posterior means anterior posterior pronunciation first, pertaining to the front and back of the body and passing from the front and back of the body. Inferior. Inferior means lower or below. So pertaining to below, lower, and towards the tail. Next, go the scan. Process of using a moving device or a sweeping beam of radiation to proceed imaging of an internal area, organ, or tissue of the body. So overview. So this chapter provide an orientation to the body as a whole. Descriptive terms are used to describe the structural organization of the body. Terms that specify the directions, positions, location of various organs in relationship to each other are included. Knowledge of these description terms is an essential part of medical terminology and provide a basic foundation for a better understanding of the body system chapter that follows. Most importantly, these terms are used in the language of medical used by healthcare providers in clinical environment. So it is a little bit overview. Next, they said level of organizations. The human body consists of several structural and functional level of organizations. So here is the two keywords. One is structural, other is functional, right? So example, cell, the cell put together make a tissue, and tissue put together for a particular function make a organ, right? And organ coordinate with the other organ and make a system. So cell, tissue, organ, even system, they combine together for particular function. So I said organ do a function. Structure basically anatomy, and function basically physiology, how body cell work. Each higher level increase in complexity because it incorporate the structures and function of the previous level, and eventually all level contribute to the structure and function of the entire organism. The level of organism from least to the most complex are cellular level, tissue level, organ level, system level, and organism level. Cellular level, molecular combined to form the cell, the basic structural and functional unit of the body. Tissue level means group of cells that work together to perform specific function. So basic unit is a cell. They said molecular combined to form the cell. Basic structure and function united body, right? And they make a tissue. And tissue groups of cells that work together to perform specialized function. Organ level, they said, the structures that are composed of the two or more different type of tissue, they have a specific functions and usually have a recognizable shape. System level said related organ with a common functions, also called organ system level. Organism level, connections of the body systems that make up the most complex level. And a living human being, all part of the human body functioning together continue the total organisms. What next? Next here, go. Showing, you see this is the cell. This is the cell, right? Different kind of cell here. Cellular level. So when a group of cells put together for a particular function, we call tissue, like muscle tissue, nervous tissue, right? Skin tissue, like dermatology. And next, this tissue together and make the organ system, right? Like liver is an organ, kidney is an organ, the part of digestive tract. Liver is the organ of hepatobiliary system, right? And finally, the make the system and the system combined together completely make human body. So next here, structure and function work together, right? Now, anatomical position, this side. Healthcare providers are also use directional terms to identify accurately the location of the disease in the body. And this term also include position of the body when performing diagnostic, surgical, therapeutic procedure. However, without a standard position, directional terms are meaningless. That's why healthcare provider must visualize the body in a standard positions. In the field of medicine, the standard reference positions of the body is known as anatomical positions. Anatomical positions. In anatomical positions, the person stand erect, the eye looked straight ahead. The thumbs are at the side of the body with the palms of the hand turns forward, and the feet are parallel to on other and flat on the floor. And also directional terms. So directional terms describe the relationship of one body part to another in reference to the anatomical positions. For example, in a person is anatomical positions, the toes are anterior of the body or ankle, and the legs are inferior to the tongue. Look at the directional term anterior and inferior in the picture. Let me show you anatomical positions, directional terms of body plan. So superior means above, front is anterior, behind the front is posterior, and this is towards the outside lateral, and towards inside is medial. So this line close to the midline of the body, and this line away from the midline. So this is the lateral. Next go, and inferior, right, on the bottom portion. Opposite of inferior is superior. Let me go here. Commonly used such term in medical report and to communicate with other healthcare providers and patients. For example, to explain the locations or positions of the liver to a patients who know where the heart is, and you can say that the heart is superior or above the liver. You also say esophagus is posterior to or behind, or trachea, behind of trachea. It is posterior on the other way. So review the table 2.1 for comprehensive summary of directional terms along with their definitions. And these terms are used to describe the location of organs in relationship to one anterior throughout. Next here, directional terms: adductions, abduction, right? Superior, inferior, anterior, posterior. Then medial, lateral, external, internal, superior deep, proximal, and distal. Let's discuss one by one. So abduction means adduction, this is abduction, A double D, movement towards the midline of the body, and movement abduction means movement away from the body, but A double D, movement towards the body. So adduction, the arms moves from shoulder and height to the side of the body. Abduction, movement away from midline of the body. The arm moves from the side of the body to shoulder height. Superior, cephalic, so above or higher towards the head, and the chest is superior to abdomen. The heart is inferior to the stomach. Inferior, also called caudal. Superior is called cephalic. So inferior, below or lower towards the tail. Anterior, ventral, front of the body towards the front. So the navel is on the anterior side of the body, and the toes are anterior to the ankle. Posterior, dorsal, back of the body towards the back. The spinal column is on the posterior side of the body, and the heel is superior to the toes. Medial, lateral. Medial means pertaining the middle towards the midline. So the mouth is medial to cheeks, and lateral, pertaining to the side, towards the side. The eye are lateral to the nose. External, internal. External and internal. External means outside. Internal means within the body. External, outside or exterior to. Internal, inside or interior to. Example, external, the ribs are external to the lungs. Internal, the brain is internal, inside or internal to the skull. Superior and deep. Superficial, towards or the surface, a scalp from the fall, a superficial wound, but deep, away from surface. So a bullet wound can penetrate deep into the abdomen. What is proximal? Near the point of attachment to the tongue or a structure. The ankle is proximal to the foot. Distal, the farther from the point of attachment to the tongue or a structure. The toes are distal to the ankle. Next go the parietal and visceral, the pertaining to the outer wall of the cavity. The patient pleural lies the chest cavity. And visceral, the pertaining to the organ within a cavity. The visceral pleura cover the lungs. Right? So this is the two. One is called, what is parietal? What is visceral? So parietal, pertaining to the outer wall of the cavity, and visceral pertaining to the organ with a cavity. So parietal, the parietal pleura lines the chest cavity, and visceral, the visceral pleura cover the lungs. Next go the body plans. So there are few kind of plans. So they said, what is plan? First of all, medial plane, frontal plane, and horizontal plane. So what is plane? Plane is an imaginary flat surface that is separate the two portions of the body or an organ. Reference of the body plane helps you understand the anatomical relationship of the body part of the another, and they are used to denote the clinical uh, divisions. So they are used to denote the clinical divisions on abdominal wall, they said. So body plans are also used to describe location of the X-ray image. For example, anterior-posterior chest X-ray, taking the frontal. So it's a anterior-posterior chest X-ray, taking the frontal before the development of computed tomography or CT scan or CAT scan, which display the image along a travel plane. Conventional X-ray image were on a vertical plane. The dimensions of the body irregularities were difficult, if no impossible, as certain. The level of the three body planes in figure. So let me show you. One is median, frontal, and horizontal. So median plane, vertical plane that passes through the midline of the body and divided the body or organ into the equal right and left side, also called mid sagittal plane. So median plane also called mid sagittal plane. And this frontal plane that divided the body into anterior other called front, posterior is called back, right? So the frontal plane also we call coronal plane. Horizontal plane that separate the body into superior and inferior. So superior, this is upper, inferior, that is lower, right? The horizontal plane also called transverse plane. Next go body cavities. So body cavities are hollow space within the body that help protect, separate, and support the internal or internal organs. So body has the two main cavities. One is called dorsal cavity, means back to the body, and verticals, the front of the body. And refer to the cavities in figure 2 to 3 as long read into the following informations. The dorsal cavity is divided into the 1. Cranial, 2. Spinal. So cranial and spinal cavity and contain the brain and spinal cord. So cranial cavity contain the brain and spinal cavity contain the spinal cord. The diaphragm is a dome-shaped muscle separate the thoracic and abdominal cavity and play an important role in breathing. Vertical cavity is subdivided into thoracic cavity, abdominopelvic cavity, abdominal cavity, and pelvic cavities. So, the vertical cavity, thoracic, this is the include our thorax, contain the lungs, particularly heart, this is the heart and lungs, and abdominopelvic means part of the abdomen, part of the pelvis. Abdominal cavity is further divided into abdomen and pelvic cavities and contain the organ, digestive and reproductive system. So abdominal cavity contain digestive and pelvic cavity contain reproductive systems. So next is quadrant and region. So to describe the locations of the many abdominal and pelvic organ more easily, anastomosis and clinicals use two methods of dividing the abdominopelvic cavity into the smaller areas. And these divisions are known as quadrant and regions. The 9 region divided is more widely used for anatomical studies, and quadrant are more commonly used to clinicals to describe the site of abdominopelvic pain, tumor, and other abnormalities. Let me go next here. Like this picture, we can see, and let me make it small for you. So use this picture, we can see the dorsal portion and ventral portion. So in dorsal, this is a cranial and spinal, right? So the cranial portion cavity contain the brain, but the spinal cavities contain the spinal cord, right? And you can see this is the diaphragm. This is the diaphragm. Separate thoracic cavity from abdominal cavity, right? The thoracic cavity here contain heart and lungs, and this is the abdomen and this is the pelvis. Both together we call abdominopelvic cavities. So abdominopelvic cavities is further subdivided into abdominal and pelvis. Abdominal and pelvis. Abdominal and pelvis. So pelvis basically contain our reproductive system, and abdominal cavity contain digestive system, right? And thoracic, abdominal, pelvic all together we call vertical. Next here, abdominopelvic quadrant. So for quadrant, identify placement of internal organ in the abdominopelvic cavities. And generally, quadrants are used to report the findings of a clinical examination or an exploratory surgery. For example, a physician may describe a patient's abdominal pain in left upper quadrant, and this quadrant indicate different clinical possibilities than if the pain were in the high lower quadrant. Quadrants are also used to describe location of surgical procedure, incision site, and tumor. So use the following abbreviation to label the quadrant in the figure 2.4a. So right upper quadrant and right lower quadrant, left upper quadrant, and left lower quadrant. So imagine abdomen is divided by two lines. So if we say this is right upper quadrant, this is right lower quadrant, this is left upper quadrant, this is left lower quadrant, right? So next go here. Upper, so okay, so let me go. Okay, so upper quadrant contain the organ or right lobe of the liver, gallbladder, part of the pancreas, upper part of the small and large intestine. The right lower quadrant contain part of the small and large intestine, appendix, and right ovary, right fallopian tube, and right ureter. Left upper quadrant contain left lobe of the liver, stomach, spleen, part of the pancreas, and part of the small and large intestine. And left lower quadrant contain the part of the small and large intestine, left ovary and left fallopian tube, and left ureter. So NCLEX P and board exam, if question come like this, you have to answer. Okay. Next here, abdominopelvic region. So abdominal cavity divided into the 9 regions. Quadrant normally used to describe diagnostic conditions, whereas the region is designations are used mainly into the locations of internal organs. For example, liver is located in epigastric and right hypochondriac region. Identify the 9 region is figure 2.4b, like right hypochondriac is the upper right region located under the cartilage of ribs. Left hypochondriac, upper left region located under the cartilage of ribs, but left side. Right lumbar, middle right region located near the waist. Left lumbar, middle left region located near the wrist, waist. And right iliac, right iliac, lower left region located near the groin, epigastric, middle region located above the stomach, umbilical, middle region located the area of umbilicus and navel, hypochondriac, lower middle region located below the stomach and umbilical regions. Next, go positioning for examinations and treatment. To provide the comfortable environment for patients during the examinations, surgery, and therapeutic treatment, it is uh, customary to expose only the body part that is being examined or treated. So now let me go and show you here like this picture, quadrant and region. So four quadrants formed when an imaginary horizontal and vertical line across the umbilicus. 9 regions formed the two imaginary horizontal and vertical lines that form quadrants. So in this picture, if we go, you see the two, first of all, this one, two quadrant formed when imaginary line, one is vertical, other is a horizontal, right? So this one, if I said right quadrant, right upper quadrant, this area, and this area basically contains the liver, gallbladder, part of the pancreas, and part of the small and large intestine. And this area, this area, right lower quadrant, contain the part of the small and large intestine, appendix here, and also right ovary in case of female, right fallopian tube in case of female, and right uterus for both men and female. This area, left upper quadrant, contain the left lobe of liver, stomach, spleen, and part of the pancreas and part of the small and large intestine. So left lower quadrant contain the part of small and large intestine, and the left of this area, left contain left ovary in case of female, the left fallopian tube in case of female, and left uterus in case of man and female both. This area, if we go, the 9 region formed with two imaginary horizontal, 2, 1 and 2, and two vertical, this and this, line to form a square around the umbilicus, right? Square around the umbilicus. So let me go a little bit more. So like this area, right hypochondriac, right? So this is the upper right region located under the cartilage of the ribs. You see the ribs under the cartilage of ribs. And left hypochondriac, this area, upper left region located under the cartilage of ribs, but left side. This one is right lumbar area. So this middle right region located near our hip bone. So it is the in between right hypochondria and right iliac region. And then go for left lumbar area. This is left lumbar. Lower right region located near the hip bone. It is in between left hypochondriac, and left iliac region. Now go this one, right iliac area, lower right region located near the groin. This area also called right inguinal region. And this left side we call left iliac area, lower left region located near to the groin, also called left inguinal region. So this area, it is umbilical area. So middle region located in the area of umbilicus or navel. And this area is called hypogastric area. Lower middle region located below stomach and umbilical region. Next go. So various body positions are employed during the medical exam, during the X-ray, surgical operation, therapeutic treatment. The position used to depends on procedure or the treatment and the sex of the patients. And 7 basic patient positions used for medical examination, therapeutic treatment, then surgeries are illustrated the figure 2.525 discussed below, and these terms are formed in the different types of medical report, including physical exam, radiographic report, and operation report. What is that? So knee chest positions, 1, then lithotomy positions, dorsal recumbent positions, Sims positions, prone positions, polar positions, and supine positions, right? There are 2 more. One is called Tendelberg positions and also erect standing positions. So let me explain one by one. So first one, the knee chest position. So the patient is assist into the kneeling positions with the buttock elevated. The head and chest are on the table. The arms are extending above the head and flex at the elbow. This position facilitates exam the rectum or pelvic organ. So NCLEX board sometimes asks, knee chest position is good for what? For rectum exam. Sometimes knee chest position is good if pregnant mother, baby has asphyxia or hypoxia. Lithotomy position, the patients assist into the supine. Supine means lie down on the back positions. Okay. And the legs sharply flexed at the knee and feet are placed. Feet are placed and the position is used for any kind of vaginal exam and also pap test. Dorsal recumbent position, the patient is assist into the supine position. The legs are sharply flexed at the knee and feet are placed on the table. This position is used to examine the vagina and rectum in female and female patient and rectum in man patient. Another position is called sim posture or sim position. The patient is assessed into the side lying positions of the left side. The left arm is placed behind the body. The right arm is moved forward and flexed at the elbow. Both legs are flexed at the knee, but the right leg is sharply flexed and positioned next to the left leg, which is slightly flexed. This position is used to examine the vagina and rectum in female patients and also rectum in a male patients. Sims positions is also used to administer a enema. Prone positions. The patient is assessed to lie flat on abdomen with the head turned slightly to the side. The arms are extended above the head and alongside the body. The prone position is used to examine the back, supine, and lower extremities. Now, polar position, the patient is assessed into the semi-sitting posture. Head of the examination tab is titled to produce 45 to 60-degree angle with the patient's knee and bend or not bend, and angle 45 degree or more consider the high polar. I will show you the picture so you can easily understand. And so ankle approximately 30 degree considered semi-polar. These positions promote lung expansion. It is used if the patient has a difficulty of breathing. Supine positions, the patient is assessed to lie flat on back with arms at the side. This position is used to examine the chest, heart, abdomen, and extremities. It is also used to examine the head and neck, as well as in certain neurological reflex testing. The two other commonly used positions are erect standing position and Tendelberg positions. The erect standing positions, also referred to anatomical positions. There are one picture we will see later, and also anatomical positions depends on the type of exam. Patients may be illustrated bend over, walk, or more specific body parts in the particular manner. The physician observes this movement to determine the patient's level of coordination, strength, flexibilities, balance, and range of motion. In the Tendelberg positions, the patient is lying flat on the back. The entire examination level is titled with the head of the table below, and this position is used for therapeutic treatment such as postural drain in patients who have thick respiratory secretions. What else? So there, here the picture. I want to explain one by one. You will understand better. So in this picture, this is the knee chest position, right? So This patient is kneeling position where we can see the buttock is elevated and head and chest are on the table, right? And patient's arms are extended above the head and flexed at the elbow, this one elbow. And this position is facilitate examination of particularly rectum organ or pelvic organ. Next position, this one is called lithotomy position, right? Lithotomy. So this position, lithotomy, the patient is assisting into the supine, because patient supine means lie down on the back and two legs are sharply flexed at the knee joint, and the feet are placed in a two device. You see, there are two devices, and this position we use to examine the vagina or examination the pelvic organ, or also collect the tissue called pap test. And this position also good for normal vaginal delivery. Next posture here called dorsal recumbent positions. So this patient is assessed into the supine position and two legs are sharply flexed at the knee joint, and the feet are placed on a table. And this position is used to examine the vagina and rectum in case of female, or rectum in case of man patients. And this is the position called Sims position. And the patient is assessed into the side lying down positions on left side. And the left arms is placed behind the knee. And also the right arms is moved forward and flexed at the elbow. Both legs are flexed at the knee, and the right leg is sharply flexed and positioned next to the left leg, you see, and which is slightly flexed as well. This Sims positions is used to examine the like this vagina and rectum in a female patient and rectum in a male patient. Sim position is also used to administer the enema. And this one is prone positions. So the patient is assessed to lie flat on the abdomen with the head turned slightly to the side. The arms are extended above the head and alongside the body. The prone position is used to examine the back, supine, and lower extremities. And next position, this is two, is called Fowler posture, right? So this patient assists into semi-sitting posture. The head of the examination table is make an angle here, you see. It is 45 to 60 degree angle with the patient's knee or bend or not bend. So an angle 45 degree or more, we consider high Fowler. Angle approximately 30 degree is considered semi-Fowler. And this positions is promote lung expansion. And it is used if the patient has a difficulty of breathing. And next posture is called supine position. So the patient is assessed to lie flat on the back with the arms at the side. There are two arms at the side. This position is used to examine the chest, heart, abdomen, and extremities. It is also used to examine the head and neck as well as the certain neurological flex testing. So there are few positions we talk about with some picture. I believe it will help you to better understand. So medical ward building, they said. So constructing medical ward using the ward elements and related to body structure will enhance your understanding of those terms, also reinforced your ability to use the term correctly. Com Combining forms. So benign your body, study of the body structure and terminology by using associate combining forms as out of the following tips. This introductory study of CF provide means combining forms provide an understanding of constructions and meaning of medical term related to the body regions and body structure as well as they used to directionally terms. You may also be referred Appendix A. It is called gross medical word elements to complete this exercise, and this one is completed for you. So here are few combining forms: body region, abdomen, abdomino. So you have to meaning abdomen, abdominal or abdomino, minal like abdominoperitoneal or abdominal organ. So like cordo means tail, caudal towards, and cephalo means head, cephaldal or cephalate towards. Then cervical means neck, cervical uterine, neck of the uterus, cervical, right? Cervical, the sage, or this is neck area. Then cranium, like cranial, treating. Gastro means stomach, gastric. This is pertaining. Ileo, ilium, lateral or flattening problem of the hip jaw bones, iliac, right? And then inguinal means groin, inguinal, right? Pertaining to, and then lumbo means loin, lower back, lumbar, pelvic, like pelvis, pelvimeter, instrument for measuring, pelvic, right? This part 18. Then spinal means spine, spinal, right? Spinal. Next, go here. Thoraco means chest, means thoracic organ, right? Umbilical means umbilicus, navel, umbilical. Then go next here. anterior, anterior front. Then distro means far, farthest, digital. Dorso means back, dorsal. Inferior means lower or below, inferior. Then lateral means side or to one side, a lateral. Then medio means middle, medial. And posterior means back, posterior. Promixio means near, proximal, right? Proximal. Then superior means upper or above, superior, superior extremities. Then ventral means belly side or ventral. Okay, ventral organ. Next, cyto means cell, like cytometer, cytology, cell related. Histro means tissue, histolysis, histology means something tissue related. Then nucleo means nucleus, nuclear. And then radio, radiation, X-ray, radius, bones on the limbs, radiography, nucleus or nuclear, right? So some suffix and prefix. So in the following table, suffix and prefix are listed alphabetically. So other word part of the defined as needed. Review the medical word and study the elements that makes up the term. Then complete the meaning of medical word in the right hand column. You may also refer appendix gross here medical word elements to complete this exercise. So suffixes, like I said, it means to word, like medial, mediate or middle, and then ARL, it is coronal. Okay, coronal suture, or coronal means heart, coronary arteries, right? Coronary. Next here, like analgesia or pain, analgesia, pain, it is costralgia, rib pains, thoracodynia, right? Thorax or chest pain. Next, go here. They say pathogen, right? Means disease or organism. Or carcinogenesis, like cancer. So forming word, producing organ. It's called gen. It's called genesis, carcinogenesis. Histologist, tissue. So logist, it is specialty in the study of. Then here etiology. So etiology, cause, study of logy. Then cytology, cytolysis. So lysis means separation or destruction and loosening. Cytolysis, separation, destruction, and loosening. Then thermometer, it is instrument used to measurement. Hyperplasia means forming or growth. Plasia, right? Excessive or above normal. Then hepatotoxic, liver toxicity, poison, toxic substance. Next, go bilateral. Bi means two, side or one side. Epigastric, epi means above, stomach. Okay. And infra means below, under, infracostal, ribs or part eating. Next, go transvaginal. So across or through, trans. So this is the chapter for now from here. So also there are some medical terminology, word building. So you have to practice this phase according to you what like. So medical vocabulary more, disease and medical conditions. First of all, this is called adhesion, right, or adhesion. So band of scar tissue binding anatomical surface that are normally separate from each other. Now, inflammations means protective response of the body tissue to irritations, infections, or allergies. Sepsis means body information response to infections in which there is a fever or elevated heart and respiratory rate and low blood pressure. What next? So here we see abdominal and adhesions most commonly form in abdomen after abdominal surgery, right? Inflammation occur and injury. And next here, endoscopy. Endoscopy means visual examination of interior of organ and cavity with a specialized lighted instruction called endometrium. Fluoroscopy means it is luminance, fluorescence, visual exam. So radiographic procedure that is used to fluorescence scan inside a photographic plates to produce a visual image from X-ray that pass through the patients and resulting in continuous imaging of motion of internal structure and immediate the serial image. So in this picture we can see a doctor examine a patient by endoscopy, right? Endoscope. Biopsy also taken the tissue for histopathology. Next here, MRI. MRI means magnetic resonance imaging. So radiographic techniques that used electrogenic energy to produce multiplanar across the sectional image of the body. Another is nuclear scan. So diagnostic techniques that produce image of an organ area by radiology or organ by radiographic of concentration of radiopharmaceutical substance called a tracker, usually introduced into the body by ingestion, inhalation, or injection. Radiography means radiations, X-ray, radius, lower arms brown on the thumb side. Process of recording. So produce of the capture shadow image on photographic film through the action of immunizing radiation passing through the body from external sources or source. So here few example, like picture some imaging. Picture A, it is the chest radiography, anterior posterior view. This one we can see the cardiac shadow, right? And this is the trachea and two lungs, and this is the diaphragm, and you can see this is the intestinal area. Number picture B, ultrasonography of the blood flow with color indicate the direction. So this is the ultrasonogram showing the flow of blood. And number C, this is a nuclear scan of livers and spleen. So this is the liver tissue and this is the spleen, but this is the nuclear scan. And number D is CAT scan of the eye, right? And number E for MRI scan of the head and PET scan of the brain. So this one, MRI of the brain, and this one is called PET scan of the brain, and this is also MRI. So next go some radiopharmaceuticals. So drugs that contain a radioactive substance which is traveled to an area or a specific organ that will be scanned. So radiopharmaceuticals, we said, or radiography. So radiography techniques that produce a film presenting a detailed cross sections of tissue structure at a predetermined depth. Next, it is called computed topography scan. So narrow beam of X-ray with a contrast medium or without a contrast medium, that is target a specific organ or a body area to produce multiple cross-sectional images for detecting pathological conditions such as tumor or metastasis. Positions emission tomography, shortly called PET scan, position emission topography. So nuclear imaging study that combines CAT scan with a radiopharmaceuticals to produce a cross-sectional image of radioactive disbursement in a sections of the body to reveal the area where the radiopharmaceutical is being metabolized and where there is a deficiency in metabolism, and useful in evaluating Alzheimer's disease and epilepsy. Then single proton emission, computed tomography, right? So nuclear image study that scan organ after injection of radioactive and employed specified gamma camera that is detect the emitted radiations to produce a three-dimensional image from composite of numerous view. So basically, these pages talking about some radio imaging or some procedure to diagnose the diseases. So at least we have to be uh, familiar, or we have to know how to pronounce this keyword like endoscopy, fluoroscopy, magnetic resonance imaging, radiography, then radiopharmaceutical tomography, computer tomography, right? And PET or position emission tomography, ultrasonography, CAT scan. You have to know all of this medical terminology, right? And here's some example for you. You have to find it out where which one can sit. So you have to practice, and then you can complete these pages. So this is the chapter uh, 2 for today, body's image.